Okay, we are going to discuss about one disease condition, that is the leukemia. Okay, first of all we learn about blood. Okay, what is the blood, where it is present. Okay, what is the functions of blood. Okay, blood is a one type of fluid. Okay, it will be there in the human body. Okay, compulsory the blood will be there in the human body. What is that function means? The blood having the main functions like transportation. Okay, in that blood what is the transportation means? Nutrients. Okay, once we are taking food means the food should be digested. Okay, the digestive particles, that energy will be mixed with the blood, and the blood will be circulate all over the body parts. Then the all body parts receive some energy from the blood. Okay, next we are inhaling and exhaling. No, okay, we are taking or we are maintaining respiration. No, okay, what is the respiration pattern means? Inhalation of oxygen. Okay, we are inhaling oxygen and we are exhaling carbon dioxide. Okay, when we are inhaling means the oxygen will be enters into the lungs, and that will be mixed with the blood and circulates to the all body parts. Okay, which organ is there in the body? The organs will be receives some oxygen through the blood only. Okay, the blood having transportation function. Next another one is the protection. Okay, all body parts will be protected by the blood only. Okay, the blood should be regulates the fluid. Okay, sometimes the blood having the one function like maintains the temperature. Okay, which is excess fluid will be there or waste products is there, waste fluid will be there in the body means that will be purified in the kidneys and liver. Okay, how means through the blood only. Okay, the liver and kidney will be purified this blood. In the kidney the blood will be purified and waste products will be excreted in the form of urine. Okay, these are the main functions belongs from the blood only. Okay, in the human body blood percentage is there in the normally means the human being will be healthy, especially children who are having hemoglobin percentage normal means there is no any abnormalities. Okay, they are having any abnormalities means or low hemoglobin percentage means the children having the so many types of disorders. Okay, in this leukemia disease condition is a one type of blood disorder. Okay, especially blood disorder. Leukemia nothing but cancer of blood forming cells. Okay, especially the leukemia is cancer of blood forming cells. Okay, where it is formed the blood means blood especially form in the bone marrow. Okay, in the human body having bones, no, in that bones bone marrow is there. Okay, in the bone marrow some cells is there, that is the stem cells is there. From the stem cells the RBC, WBC, platelets production is there in the normally. Okay, from the bone marrow, in that bone marrow stem cells is there. From stem cells the RBC production, WBC production, platelets production will be there. Okay, this is the normal blood forming process. Okay, here what happens means cancerous to the blood forming cells, especially in the bone marrow that stem cells having the cancer. Cancer nothing but excessive growth. Due to the excessive growth the normal function should be abnormal. Okay, that's why we are called as the this type of leukemia is a one type of blood forming disorder in the children. Especially the disease will comes to the children. Okay, in this what happens, what type of cancer means it is a one type of malignant disease. Malignant disease nothing but one part. For example, in the humerus bone, okay, having this type of leukemia means this leukemia disease easily spread to the all over the body parts. Why? Because the blood should be circulates all body parts, no? Okay, in the lower extremities or in upper extremities or in a spinal cord or in the ribs. Okay, which part may be affected by this malignant disease means another parts also spread this disease. Okay, this is leukemia is a one type of malignant disease. Okay, especially the malignant disease or the leukemia will be comes or occurs attack in the children who are having the age group, that is the 3 to 5 years of age group children. Okay, 3 to 5 years of age group children mainly prone to get this type of leukemia disease condition. Okay, this is the definition of leukemia. Next we will discuss about causes for the leukemia. What are the reasons why the leukemia will cause to the children means in this the causes exact cause is not known. Okay, for example, due to these reasons only the children may be affected by this leukemia disease condition, like that there is no particular reason for cause of leukemia. Okay, sometimes in that genetic predisposition means through the genes from the family, in that first generation may have some cancer. Okay, that malignant cancer like brain tumors or lung cancer, or in the body any cancer is there that may be easily spread to the another body parts. Okay, in that family one person, first generation people may be affected by this leukemia means maybe their offsprings, okay, their generation people, okay, through the chromosomes or through the genes the disease may be transmitted to the one person to another person by birth. Okay, first of all this cancer may be first cause, that is the genetic predisposition through the genetical factors. Okay, by the chromosomes or the genes by birth the children may be affected by this disease condition of leukemia. Okay, next another reasons like some environmental factors. Okay, what is that environmental factors? Especially the children's mainly affected by this cosmetics. Okay, especially cosmetics, or sometimes in the environment excessive radiation will be there, or sometimes the children may be affected by the poor environmental status. Okay, due to that reasons the children may be affected by this cancer. Okay, next another reason like viral infections due to the some of viruses, bacteria, fungi. Okay, any body parts may be affected by this viral infection. The infection may be spreading to the one part to another part through the circular. Okay, the children may be affected by this leukemia. Okay, sometimes through the blood infection also. Okay, the viruses or bacteria or fungi will be enters into the blood. Okay, especially WBCs or RBCs or platelets or bone marrow will be affected by that particular virus or bacteria. Okay, they are forming some infection to that particular blood forming factors means the person may be affected by this leukemia disease condition. Okay, next another reason like radiation therapy. Okay, who children are excessively exposed to the radiation. Why? Because sometimes due to the fracture. Okay, some accidents will be there in their daily life means for identification which part or which bone will be fractured, which area means that will be identified by doing the X-ray or radiation. Okay, when the children will be exposed to the excessive types or many episodes of radiation means the children may be affected by this leukemia disease condition. Okay, next another one is the chemical exposure. Okay, who children or excessively use of these chemicals. Sometimes their parents working in the chemicals factories. Okay, in that chemical factory means their occupation. Okay, they are doing work or job by expose of some chemicals. Okay, due to that the children may be affected by this disease of leukemia. Okay, next another reason like the children's especially drug exposure. Okay, sometimes chronic diseases is there in their body parts. Okay, some chronic diseases, for curation of chronic disorders they are using continuous medications. Okay, due to that drug exposure continuously is there in their life means the children may be affected by this leukemia disease condition. Okay, these are the causes is there. First the cause is unknown. Next another one is due to the genetic predisposition or some injuries or some type of viruses, bacteria or some type of chemical exposure or drug exposure. The children may be affected by this type of leukemia disease condition. Okay, next we are going to discuss about classification. Okay, in that classification mainly two types is there. Okay, first one is the this will be depending upon the severity, means clinically or pathologically. Okay, the disease will or the leukemia will occurs to the many days or many weeks or many months, means depending upon the severity, depending upon the pathological status or clinical status, the leukemia will be divided into two types. Okay, this is the first one, in that acute leukemia or chronic leukemia. Okay, these are the two types divided into the depending upon the severity or clinical or pathologically. Okay, next another one is the second major type, that is the cells, means in the blood which cell will be affected by this cancer. Okay, depending upon the cells the leukemia will be divided into again two types. Okay, in that first one is the lymphocytic leukemia. Okay, lymphocytic or lymphoblastic leukemia. Another one is the myeloid or myelogenous leukemia. Okay, these are the two types divided depending upon the cells, which cells, B lymphocytes or T lymphocytes or platelets. Okay, which cell may be affected by this leukemia disease condition. Okay, depending upon the cells will be affected these two types. Okay, these are the classification is there regarding leukemia.